So I think live have started. Okay, it's here. Hello, good evening all. So welcome back to yet another episode from Let's Update Language Academy. And here we are with the speculation. And today, for your surprise, I'm not alone. And we have one lady with me. So we'll introduce ourselves first and we'll start into the session. My name is Priyanka Pratas and from Let's Update Language Academy, and this is a Let's Update member.
Well, my name is Akhila John. I'm as you have told, I'm also a Let's Update member.
Yeah. Hi Ashwati. So, excuse me. Alright, so today, as you all know, we are here to speculate the questions, and as I often say to them, this is just not speculation. We will be discussing a lot of questions that have been asked in the previous examination, and from which we'll be coming into a conclusion, right, Akhila?
Yes.
So,
some probabilities.
Yes, it's all about the probabilities. Okay, excuse me. Okay. Anyway, so I'm so happy that there are a lot of students who are excited and waiting to attempt the next Saturday's examination, and all the very best to them initially. And I'm sure that you have worked really hard for your examination, and that will be paid in the day of examination. And let the Saturday be very fruitful and exciting for you, isn't it?
Yes.
Okay, so I think yeah, I'll get the comment soon. So hi Sanya. Hi, so there is Saria watching us, and Ashwati. Can I get some more hi? Okay, Maria Joy, hi. Alright, anyway, so I think Akhila, you can start with the initial sessions. So definitely we'll be focusing more on the speaking session, but then we'll be explaining the initial for the beginners, the first time who are attempting the examination, what you should expect there. So Akhila will give you a brief introduction about that, listening, reading and writing, and then we both will discuss speaking, and probably we can have some mock tests or mock sessions on speaking, which would definitely help you tomorrow, okay? Yes, so you may start.
Yes, as we all know, there will be four exams we need to be there. So for the beginners, for someone will be initially they won't be not knowing much about OET, what at first time when we are attending, we are not aware what will be the exam. We'll be having a lot of worries and queries about that exam. So
exactly.
First of all, we'll be
starting the session with listening. I guess.
Yes. Before that, something like identification criteria.
And check is there, identification criteria and check are there. So what are the things that you should bring to the examination hall before?
Yes, you are not allowed to take any watches or any electronic items to there. So they will be having a cloakroom. In the cloakroom, they will be taking away our bag and all belongings, including phone, watches and all. And you can take a transparent pouch if needed, or you can just take some pencils, erasers and sharpeners, that's it, and your identification, passport.
Yeah.
And in some centers they will ask in addition one ID, that can be your Aadhaar or something like that.
Alright, so make sure that along with the passport, take an identification, card, better it's Aadhaar. I don't think that every examination center that they would ask for it, but I guess some of the examination centers they would ask.
There's a chance.
Yes, so better don't take risk in the morning. So let's carry our identification card along with passport. Okay? Yes, please continue.
And then we'll be as I've already mentioned, in the cloakroom they'll take all our belongings, and you will be permitted to take these pencils and this ID card and passports along with you. And according to the order, they will be identifying you. There will be some certain officers. They will be they will be there in a table with laptops and all. They will be identifying you. They will be taking. They ask to remove our mask, not to take the photo of yours.
Okay.
Then they will upload to the site and so and so. Then you will be identified as in an order, then you will be taken to the exam hall.
All
That's
right.
it. That's the initial thing.
Procedure. So from this explanation, what you must understand is not about the long procedure. You do not have to by heart it or get familiarized with it. But the one thing that you should be very sure is that it is a time-taking procedure.
Yes.
So please be early to the examination hall so everything goes very peacefully, because I'm sure that there are some kind of butterflies in your stomach before the examination. You're a little tensed, I know. So it's better that you can go a bit early to the examination hall, because you have these procedures to undergo. Okay, so that's the first thing. And
One
yeah,
more thing is that
please add.
we'll be getting a mail, confirmation mail. So there will be an invoice and in order to for that COVID protocol. So we
Okay.
need to take that printout also sometimes.
All right. Okay. So do take the printout or the confirmation mail along with you. So I've got some hi from some of our students and the people who watch this. Hi Das, hi Abil and Anju Sabu. And Sri Lakshmi, hi. And again Ambali, Dinsi, Anju Sojan, Akshay, hi. Thank you for watching. And let's discuss about the speaking. Before that, I think the first module is listening, right? Yes, so the order is LRWS. So I'm sure that you know about the minutes, but how much duration is listening, reading, but is there anything that's before this listening test?
They will be giving some time in order to check the audio. See, during this exams, it's seen that when we are getting into that examination, almost everyone will be taking this headset and will be like that. You can check at the time, but also before that, you can just ease with that.
Okay,
but
get used to it.
Yes, get used to it, and also no worries, you will be getting time not to check the audio in case some will be having some
distractions,
something like that. Then you can directly report to them. Yes, excuse, and you can ask them. You can tell them that if something is not clear about my audio, some issues I have relating this audio and
okay, so definitely report it, because this is your examination. So check it carefully and report it. If you really feel some disturbance, report it to the examiners at the moment, because once the audio or the examination begins, they won't replace or do anything for you. So before that, please report and check it clearly. Alright, that's the one thing we would like to say. And I think there are some instructions which is given to you before we start the listening test. Am I right?
Yes.
Can you just summarize what are the general instruction that they should expect?
They will be before all the sessions, you will be giving certain time to read this instructions and all. And also, if we are starting with part A, you will be having 16 or 19 minutes to go through that questions. After that, the audio will be played. As the listening test, we are practicing in that same way itself. It is happening over there. So they will be instructing us priorly.
So yeah, that's an important thing. So if you're practicing in the appropriate way, that you can expect in the examination hall also. So I've seen students going through the practice materials in the phone. I think that is not the exact way that we get in the examination hall. You have to practice with a paper and the question paper and the audio plugged into your ears. So you'll get an appropriate atmosphere of the examination, and you don't feel any difference from the examination hall the practice sessions that you have already done here. Okay, as I always mention, this listening and reading is actually a personal skill that you need to evolve when you grow up, right? So but then how can we improve your listening and reading skills in a very short period of time, around 1 or 2 months? What do you think, Nikla?
I think continuously practicing.
Yeah.
Of course, listening and all, someone from other side, like a third person or second person cannot do anything to us.
Yeah.
The thing is that we need to listen. We need to improve our listening skills.
But one thing a third person can do to you is they can guide you with the instructions or with the experience that they have. So that is what the shortcut is. So definitely a foreign accent would not be familiar for us. So some of them would be familiar. So it may differ from person to person. So how to get used to it is by a constant systematic practice in listening. So a proper guidance in the listening can definitely help you to improve better. So what to listen is again an important thing, I guess, because you can listen. There are a lot of things that you can listen, but here the examination is OET. So when you practice for the examination, you definitely have to do the question papers. I mean the sample test or the exam related materials. Along with that, in order to improve you listening, if you feel very troubling or tough in listening, then in order to improve the listening, you have to choose some other methods also.
Podcast.
Yes, podcast or some other conversation between nurse and patient. So such audio has to be selected because in the examination also you will be getting the scenario related with the medical field. So it is better you can choose those. So be very careful in choosing those things. Apart from the normal films, definitely that will help you in a longer course, but in this short course what we can resort to is these kind of things. Okay, so you can select it, and what is the training basically is about. If you are undergoing a best training means they would select things for you and they will help you or guide you to do it this way, which will help you to improve. So you are playing an important part in this listening and reading, but the training part is like what has to be practiced is a choice that the trainers or the training institute will give to you, and that should be carefully taught. Okay, teach Yorkshire accent here. Alright, so good evening. Hi ma'am. Jose Dina, Yorkshire accent to your students. Okay, well, yeah, that's actually a good suggestion. Yorkshire accent. It's not about just Yorkshire accent or any British, American, or there are a lot of New Zealand, Australian. There are a lot of accents that is in the audio, I guess.
Yes, it's not similar ones.
Yes, it can vary because it's an international test which is incorporating a lot of countries. The opportunities are to a lot of countries. So all the English-speaking countries audio we can expect in this speaking session. So definitely one good suggestion is that we need to get familiarized with all these accents. And thank you, Jose and Anu Albert. Hi, Jisha. Hi, Nichita. Hi, welcome back. And Shamali. Hi, Shamali. Josina. Hi, Josina. Akshay. Hi. And coming to the reading, so we can just go through the division in reading. I think better you can talk about that.
Yes, as reading will be having 3 parts. Part A, then part B and C. First of all, they will be, see, the one most thing I've already seen while from the students was that we will be having 15 minutes for the reading.
Yes.
So while practicing into like in a course or in a short period of 20 days and all, most probably students will be practicing with a time period of 13 minutes.
Yes.
But see, it's okay, you can practice like that, but always try to finish in that time period.
Yeah.
And also you won't get, if we are collecting back the answers, they will try to write something like something that doesn't make any sense over there, because once you are asked to put down the pencils, you should do that.
Yes, that's very important. Yeah, that's a very important point that she have mentioned it, because maybe in the practice session I've seen students, I understand that how much curious they are to write an answer that they know, but it is so much important to finish it on time. That 15 minutes means 15 minutes. They don't give you another second for you to write. So they will announce, put your pencils down. So we cannot write until the examiners come near to you. So we'll have to put our pencils down where it is instructed. Otherwise we'll get a warning, first and final warning, and we'll be taken for further punishment. So if you don't obey that. So it's always better to practice in 30 minutes, and I think here we make students practice to finish within 13 minutes. Not initially, but when it comes to the exam batch, we focus students to finish within 13 minutes, because that will be very useful for you in the examination hall. Because when you change the atmosphere, definitely when you are in a new atmosphere, the things would also change. Maybe you would take 14 minutes, again then you'll get 1 minute, or maybe you will take correct 15 minutes. Okay, but then also you don't have to run out of time if you practice within 13 minutes. So that's one important thing that we can do. Okay, so we have some more. Hi, Naufal. Hi. Nidu Kuriakos. Hello. Hi. And Catherine. Shiny Priya. Hi, Catherine. Okay, yes. So that's it. And this after this 15 minutes, I think you can little relax.
Yes.
Yes. Now the part B and C. Most probably the students are quite, they might be having some uncertainties or queries about this part B and C. because it is multiple choice. Until and unless till you get the result, we don't know whether it was right or wrong, because we don't have a exact answer key for this. So that's one thing that I've often seen among students. Like even after the examination, when we ask for the comments among the students, they would have a clear picture about the part A, but when it comes to part B and C, they're quite confused. They don't know. They might feel that it was okay, it was good, but then again, they're not strong enough to say it was good. Yeah, that's Chiku Philip. Okay, all right, yes. Then, alright, so now let's move to the topic of the day, that is speaking, and that's the reason we are here. Oh, sure, yes, of course. So, about the writing, I think you can talk about the timing and all. And we don't really give a very good detailed explanation of it, because that's all part we leave to Harish sir. Yes. So, we'll give you about the timing and the instructions. I think you can speak about that.
Yes, so totally it's about 45 minutes. You will be getting 5 minutes of reading, and during this reading time, always like we don't need to cut short this time, because exactly you will be getting 5 minutes over there. At the time, you will not be allowed to take pencils or anything to note, and you won't be allowed to do so. So at the time, you can just so our students Harish sir is asking to first identify the task. Like he structured us in that way. I think it's the best way to do so.
Yes, actually collecting the data, identifying the relevant and irrelevant is what that we have instructed our students to do in this 5 minutes, to structure it in our mind, because we can't even touch the pencil.
So in a way you can like decide like what all the things we can do, what is the exact task, is it known case or unknown case. We can completely get an idea throughout this question, means the lecture at that time. And once if this 40 minutes starts, you can start writing. At that time, there is no it's not necessary to start writing at that time.
Yeah.
Even though you need something to picturize or to just make a plan, you can do that at the time, and you can move to the writing. So we'll be like, in case we are practicing planning first 5 minutes or 10 minutes, then writing, that's completely fine. But once you are there, you don't get panicked by seeing others writing, or will I able to finish? Nothing like that. If you are practicing in that way, you can do that. You can stick on to that. No need to change anything while seeing others. Don't get hurry. You can do that in that way you have practiced, because 40 minutes I think you will be able to complete. And always try to read. If you are okay, try to find some time to read the answers, at least to recheck the answers and word counts and everything in overall. That will be fine.
Yeah, that's actually again a very good point to be noted. I mean, we get panicked by the people around you finishing it up, or when you finish it early also we are panicked, because still people are writing. Why I don't have enough to write? So,
but see, we will be saying that those people who have started initially with a hurry, we can see that after a time they will be rubbing.
Rubbing and again clearing it. It's all fine. Whatever you feel like doing, you can do it. But if you have a plan, you can structure it, or you wanted to write down the introduction initially and then see whether to finalize it, because you have a space for rough work, isn't it?
Definitely.
So you can do anything in the rough space that is given to you, and then you can make a fair copy of it in the paper that is given to you. Okay, so you have enough time. Actually, I'm sure that in our school days and college days, we have written a lot, plenty in our paper. So 40 minutes in just one letter would be very easy for us to finish. So the only thing is the time we take is for planning it. So read the task very carefully and plan accordingly. Definitely you will be able to finish it. Hi Manju. Hi. So yeah, that's it. Again, can we move to the speaking session? Yes, finally we are there. So we would probably start with the introductions.
Different introductions.
Yeah, different introductions that you can expect. It's not like there is not just two options like non and unknown case and two introductions. No. There are different scenarios, but it is not plenty. We can just count it and practice. I think probably 5 introductions, I can say. So this would be the scenario that you can expect. So as I always repeat, the speaking card is well structured and they haven't changed the structure yet, because I think Akila as a trainer would be seeing a lot of speaking cards,
Yes.
you know, and haven't you find out a proper structure in it?
Yes, like it is the same structure but in different scenarios and
Yes.
setup. That's it.
That's it, and even scenario is again limited, I
Limited.
guess. So it's almost, once you understand the structure properly, then everything, I mean everything in the cart would be
You can
seen
handle
very
it.
easy. Yeah, it is handle. I mean you can handle or manageable. It is. That's it. So that's why we say that there are only 5 introductions that you need to check into. For example, let's take the case of emergency department. So there are 5 settings like emergency department, home visit, then hospital ward, then
Health center.
community health center and clinic. Yes, yeah, this is clinic. These are the 5 settings. Suppose emergency department, what do you think? It is a known or unknown?
It can vary.
Yeah, it can vary. That's true. It can be known or unknown. And when are the cases? Which are the cases where we have known cases?
Like see, if in case of emergency department, like there can be an emergency, like someone is coming, just met with an accident, that can be unknown.
Yeah,
See,
definitely.
If the patient is admitted early today, okay, they will have
Maybe in the morning.
morning dehydration.
Okay.
We had dealt with a card that a child with dehydration.
Yes.
Child and mother role play card.
Yes.
In that role play card, it was an early morning admission. So
Yeah.
by late
Evening.
we as a nurse we are going to do a canalization for the child.
Okay.
So that's definitely a known case.
All right.
And also that setting is an emergency department.
All right. Yes, that's it. So emergency department, it's like the already we are done with one procedure, or maybe the patient is already there, as you said, in the morning or in the early today, and now we are moving or going to talk to the patient for another something. And other than the first procedure, we'll be moving to the second procedure. It can be about the details about the discharge, or it can be talking
Vital
about the
signs. Vital signs. Anything, any procedure.
any procedure.
Aftercare.
Yes, after the admission. So in such situations, it is a completely non-case. In that situation, how do you have to introduce?
Like we already know them, so during the preparation time we can ask the how can I address you, or in case if it's child and mother we can ask child's name too.
Yes.
So see we may be not aware about in the practical setup, if we are working in in
Emergencies.
your area,
Yeah.
like not in abroad or anywhere, like in your health setup, if you are working we will be identifying the patient party with the name of the patient. So
Yes.
it will be more good if we are asking like with the child's name. If I am not wrong, am I speaking to Ria's mother?
Yeah, that's
It
what
will
we
be
are
more
better.
good.
Yes.
Instead of asking, am I speaking to Mrs. whatever?
Yes.
Like,
Yeah, because
child is the patient there.
Yeah, we will be familiar with the child's name more than the parent name. So that would be a better introduction. And it's important that you need to introduce to them, because the nurse wouldn't be familiar to the patient, but we know their records. We have their records, but the nurse may be new to the person. So it is better you can start with your name. So for example, can you just demonstrate it for them?
If we are seeing them in late afternoon or any time, we can just start with hi.
Yes.
It's better. Like
Yeah.
you can start with good afternoon, good evening, whatever. It's better like hi. Well, my name is Akila John. I'll be taking care of you today. I'm working as a registered nurse in this medical clinic or in this emergency department. If I'm not wrong, am I speaking to, if the child's name is Ria, if I'm not wrong, I'm speaking to Ria's mother, right?
Yes. So that would be a better introduction. But in the other case, if it is an unknown case, and you're in an emergency department, and from the scenario you get an idea that the condition or the situation is quite literally an urgent or emergency situation. In such cases, we should not have a long introduction. We cannot go with a long introduction. Instead, what we can do is, we can start by saying, hello, my name is Priyanka and I'm the nurse in charge of this emergency department. You are looking so uneasy, or you are looking unwell, or you are looking worried. How can I help you? Okay, unwell, uneasy or worried. How can I help you? So that should be the immediate question, because we need to meet the emergency of the patient rather than asking into the name or other details. But once they explain the problem to us, we should actually share the feeling that they share. For example, if they are very tired and feeling very unwell, you can say, I'm so sorry to hear that, but don't worry, you're in the right place. These are the cliches, but don't worry, we are the health professionals here to help you. So we'll look into that before that for our communication, or for the record, can I know your name? You can take the name from the patients. Okay, so this is one way to deal with the unknown and non-case in emergency department. Yes, and we often see scenarios where it is clearly written that you have just examined, or you have done just done the clinical observation, or you have just completed wound dressing. Okay, so why might they have written this? You have just completed or examined or done. What might be the reason?
Like that will be, of course, a known case. We are also, like, we will be communicating in real life setup also. We will be communicating with patients after doing a procedure. Sometimes we will be communicating them regarding the aftercare. Like that kind of cards can be there. So that is, of course, if we are seeing just exam, just done the procedure, just remove the cannula, that is of course a known case.
Yeah,
that is the thing we need to identify from just examined or examined cards.
Yes, because why would they have written it's you have just, you is important, you have just examined is important. That shows the time period when we have done that, and it is clearly said that just now. Okay, and who have done that? You. Definitely you don't do any procedure or any function to an unknown person. Definitely you will break the border by introducing yourself and also making sure that this is the right person that I need to do the procedure, and you have completed the procedure. Now you have to start after procedure. I mean, the introduction should be like, thank you Akhila for cooperating. I have completed the dressing, and I would like to give some instructions to you. But before that, how are you feeling? Okay, so this is the one way, or thank you for the cooperation.
And it can be like two
yes.
cards. If same cards you're getting, just exam cards can, like, there will be two role play cards in this examination. So if you're getting two of them, you are getting just exam, try to make different kind of introductions.
So in both the cases, you might get that you have just examined or you have just done. In such cases, don't go with the same introduction. That looks like it's a pre-prepared introduction and you're not spontaneous enough. So better you can make some slight difference. It need not be a very totally different two introductions, but some slight difference you can bring into that. Otherwise it looks monotonous, and also it's a pre-prepared one. It's not spontaneous or very natural as you meant to. Okay, so that is how I think that's good. Okay, Rajana has said that it's not case. Very good. Devi Manoj, hi Devi. Okay, so that's very important, and it need not be in the case of this just examined. Let it be any card, hospital ward, two hospital wards, or two similar situation. Don't start the card in a similar way, because the examiner will be listening to it, and examiner would feel that there is nothing new, or the candidate is not that spontaneous enough in their language. So you can get better impression from the examiner if you start in two different ways. Am I right?
Yes.
Yes. So that's one thing that we need to note it down. And what about the complete unknown case? How do we identify it, and how do we start with that?
Complete unknown case. See, we can introduce ourselves, and if the card is to ask them the reason, find out the reason behind your visit.
Yeah.
So we can introduce like, hello, my name is Akhila John. So I will be taking care. If I am a registered nurse working in this outpatient clinic, so I'll be taking care of you today. For my better communication, could you please tell me your name, or how can I address you?
Yes.
In that way, in different ways you can approach.
Yes, that's true. That's a unknown case. Yes, and once we get their name, you can say, hello Akhila.
We can communicate with that name. It will be more
hello. Yeah, that's true. Hello Priyanka, how can I help you? So you have to call the patient's name, which makes them little more close, and that shows that you are very keenly listening to them. instead of calling them you, instead of using the pronouns,
Patient and
yes,
everything.
patient cannot be used at all.
Yes.
Yes, instead of using the pronoun you, we, us, that's better. You can use the name. Yeah, that's
One more thing is that ma'am, if we are using Mr. like gender nouns can't be there. See,
Yes.
we might be not sure if the patient is like appearing like a lady there telling her name Gion
yes.
or John or Mark. How can we will be confused Mrs. or Mr.
Miss.
Instead, it's better to tell like call by name.
Name, yeah, that is there is nothing wrong in calling by name. Definitely adding Mr. or Miss is actually showing more respect to the patient. But if you are confused, there is no problem that you can call just by name. And I also recommend you to write the name in the card. Okay, otherwise sometimes on the course you may forget and you may call your all trainer's name. You have been practicing so far. So it is better you can write down the name and also be sure that you are following the same name. Okay. So that's one thing, that's very important thing. And this is a completely unknown case. We were talking about the unknown case, and we'll identify it by very simple method. That is, first bullet point, that it would be find out the reason behind the visit. Find out why the patient has come here, or find out the reason behind the visit. What does exactly it mean? എന്തിനാണ് patient വന്നത്? So you should identify, അങ്ങനെ ഒരു question വരുമ്പോൾ തന്നെ you should identify that this is an unknown case, because the nurse doesn't know why the person is in front of the nurse. So it's very, very clear that it's an unknown case. Okay, and good explanation, ma'am. Hi Siji, thank you. So coming to the non-case, so what are the features of non-case?
Like just examined things will be of course known.
Yes,
So
just examined things and which has got a different introduction, and I think we have explained
already
it.
told it.
Okay, and we are keeping that aside and coming to the just a non-case.
Hospital wards can be known cases.
Yes, and the first bullet point most probably would be confirm. Yes, giving explanation, or it can be give reason.
Then appointments can be
non-case. Yes,
just taken an appointment. They
Yes.
are here after receiving a letter.
Yes, but I think we'll deal about that after explaining this particular scenario, and that has to be explained, I guess. See, when you find the confirm the reason for the visit. So you may get confused with find out the reason for the visit and confirm the reason for the visit. Confirm the reason for the visit means, in Malayalam I can explain to you, എന്തിനാണ് വന്നതെന്ന് നമ്മൾ അങ്ങോട്ട് ചോദിച്ച് കൺഫേം ചെയ്യാൻ വേണ്ടിയിട്ടാണ്. ഇതിനല്ലേ വന്നത് എന്നുള്ളത് നമ്മൾ കൺഫർമേഷനാണ്, ഉറപ്പിക്കുകയാണ്. Okay, in such situation you should understand this is a non-case. Do not mistake it as unknown case. Okay, confirm the reason for the visit, confirm that her procedure is completed, and ask how she is feeling. If this is a card, then okay, now your procedure is completed, and I would like to know how are you feeling right now, or this would be the way we go. And if it starts with confirmation or give explanation or give reason, we have to actually, it is better if you can summarize why the patient has come here and why you have come there, and also how the patient is feeling. This would be probably the first bullet point in most of the non-case. എന്തിനാണ് പേഷ്യൻ്റ് അവിടെ വന്നേക്കുന്നത് എന്നുള്ളതൊന്ന് സമ്മറൈസ് ചെയ്യുക. അതുപോലെ നിങ്ങൾ എന്തിനാണ് അവിടെ ചെന്നേക്കുന്നത്, അതായത് നേഴ്സ് എന്തിനാണ് വന്നേക്കുന്നതെന്നൊന്ന് സമ്മറൈസ് ചെയ്യുക. പ്ലസ് പേഷ്യൻ്റ് എങ്ങനെയുണ്ടെന്ന് ചോദിക്കുക. ദാറ്റ്സ് എ ബേസിക് മാനേഴ്സ്, ഐ ഗെസ്. സോ it is like I understand that, or I came to know that you from the records I came to know that you are here because you have done a surgery, and or there was a wound and your wound has done suturing, and now you are here after the suturing, and I am here to explain you regarding the wound care. But before moving into that, tell me how are you feeling right now. Okay, so if I get a better if I get the scenario, I think I would have said it better. Yes. So this is it, why the patient has come here, why the nurse is here, and how are you feeling right now. So a complete non-case would go in this way. Now, as you said, an appointment or
A letter, receiving a letter
for a review,
reminder.
In such situation, the first bullet point definitely would be find out the reason for patient's request to see you. Okay, so how do we explain? Is it a non or unknown?
It's definitely a known case.
It is non-case. and I would say partially not in the sense that the nurse have no idea that why the patient is in front of the nurse right now, but when patient explains, the nurse would get it.
Yes, I'm remembering. If I'm not wrong.
Yes, if I'm not wrong, or yes, I understand, right now I understand, from the records I got it. Okay, so these are the ways that you can collect it. Okay, so the first bullet point is find out the reason why the patient has come to see you. Okay, or patient has requested to see you. So the patient is, you know that the person who is sitting in front of you is a patient, and you know that the patient has requested to see you, and we are asking, inquiring, why have you come here? So, and the patient is telling that I got a appointment letter, or I have taken the appointment, or I got a reminder from the hospital, or I'm here for the review, whatever the scenario is, they would explain to you. Then you can recollect it and reproduce that, yes, now I understand from the records I got it that you had a dash and dash things from the hospital, and now you are here for the review or follow-up, whatever it is. Okay, then you can start the presentation with that. Okay, so are we done with the introductions? Yes, I think yes. The only one introduction left is about home visit. I think we have explained it before also. Home visit is like the same. Why the patient has come in the hospital, summary of the patient history in the hospital, and why the nurse is here at the moment, and how the patient is feeling right at the moment. So this is the method that you can ask even in a home visit, but there are few additions. What are they? Because it is in the, the person is visiting a home, so there are certain etiquettes that they should.
Am I okay to speak with you?
Yes.
Is it right time to
talk to you? And am I at the right place? Is this John's house? These are the basic introduction. I hope that is, that's clear to everyone, I guess. So you can visualize the incident. Where are you standing? Okay, you visualize yourself as in standing in front of a house, knocking the door, and somebody has opened it, and you're speaking. Is this John's house? If they say yes, and I'm John, then you can say, my name is Priyanka, and I'm from the nearest community health center, and I understand that you had undergone a surgery, or you had a hemorrhagic stroke, and you were in the hospital for around 1 month, and now I'm here to check your progress. But I would like to know how you're feeling right now, John. You can call by the name. As I said, it would make it more comfortable for the patient. Then John would say something, can I come in, is another way that you can ask. Okay, so visualize the scenario and start speaking. That would be the best way. CG Jijin, okay, hi CG, thank you. Linda, hi Linda. Alright, so now I think we are done with the explanation, introduction base. And I think you have something to talk about the vocabulary part of students.
Regarding when they are dealing with the card.
Yes.
One thing I've noticed is that when we are out of words, or when we are not we are not completely relating to the topics, we'll be lacking of words.
Yes, we'll be run out of the words. In some situation, there are certain phrases that we use.
We usually do that. The thing is that, one more thing is that, and
yes.
I would like a word. The thing is that, because they don't know what the thing is.
Yes.
They won't be able to tell at the time.
Yes, and with the students, and she say even I had the same problem.
Yes, I had this problem. Like I was having certain words, like repetition of some words.
Yes. So
when I'm running out of the words, I used to repeat that words. So I can completely understand when students are doing that same thing.
Okay, yeah, that's true. So that's the one thing that's important thing. Something like that, or like these words, clearly gives the idea to the examiner that they're having weak vocabulary at the time they're running out of words. Why? Because you have something to replace there, but you're not getting the right appropriate word, that we cover it up with the words like thing, something like that. Okay, so that is okay, but it shouldn't come too often.
If we like recognizing, I am recognizing like I have a problem like that, keep working on that.
Yes.
Maybe your speaking will be like today I have seen a student, like the person speaking is like It's up to the level. It's good, very good. But the thing was that, like, the person must be seeing this today now. The thing was that they were having word block and all.
Yes, so it's okay. That is completely fine, because even we also had the same problems. But working on it can,
if we are correcting the single mistake.
So, and non-case home visit introduction. That is true. Linda, yes, home visit is completely a non-case, definitely. Did see Shinto, if the home visit is non-case, can you tell me the introduction? Yeah, and I can say one thing, home visit means that definitely it's a non-case. There is no other way. Home visit and hospital ward will definitely a non-case. Why? Because the nurse is going and visiting the patient. The nurse will not go and visit a patient if the patient is unknown to the nurse. Why should she do that? Isn't it? He or she should do that. Okay, so that is it. Because we have some purpose or to visit a patient, and only with that purpose we'll meet. So in the home visit, a person going and visiting means there is a purpose. So it will definitely a non-case, and in the non-case, okay, we just demonstrated.
We have already done that.
Yes, I think there is a question. Okay, so there's a question. So, can we do that?
Yes, sure.
All right. So you be the patient and I'll be the nurse. So in such scenario, if I'm the nurse, I'll be in there. Hello, is this Akila's house?
Yes, that's it.
Okay, and am I speaking to Akila?
Yes.
All right. Hi, Akila. My name is Priyanka, and I'm from the nearest community health center. Can I come in?
Yes, of course.
All right. So is this the right time to talk to you?
Yes, ma'am.
Alright, fine. So actually I understand that you had undergone a hemorrhagic stroke and you were in the hospital for around 1 month.
Yeah.
So I'm your community nurse and I'm here to check your progress. So tell me, how are you feeling right now?
Well, I was feeling okay, but I'm having some issues regarding the mobility because I can't do my activities like that I've done priorly.
Okay, yeah. So this is it. The introduction is very simple. So visualize the scenario and do it. Alright. Okay. I lost the chat comments, so I'm sorry. One more question was there, but I'm not getting it right now. Okay. Anyway, so this is about the introductions, and I think I've told you regarding the weak vocabulary. Then the other thing is the spontaneous way of speaking. So how would you comment on that, Tekla? How can we show the spontaneity? The one thing that we have discussed today is about the repetition.
Dependence of the card and...
Yes, that's true. You can explain on the dependence of the card, and I'll be dealing with the repetition of the phrases. Please carry on.
Like if we already know that we are, like if we are initially starting to learn this OT speaking and all, we will be not having a better idea regarding what is role play card and all. So there will be like I can explain regarding causes, maybe infection, like inflammation, so on and so forth will be there. But there will be a cue word that I can explain. But initial stages and all, we can totally depend because
on
we don't
card.
know the thing. We
Yes.
can depend and like we can say that I can explain you regarding the causes of that. But once we are like okay with using our own sentences, if we are capable, we already know like if I'm capable of making a sentence by my own. If I am okay with it, if I can do that, it's better not to depend much on the card. Like I can explain. If a person with a better vocabulary, I think it's not encouragable.
I will emphasize. So these are the words that is directly in the card.
So better not to use that itself. Like
Yes.
I can explain this. Now next I will emphasize on that. One more thing I would like to suggest.
Yes.
See,
so
you can
instead,
change.
Yeah, definitely. Emphasize means what? Give importance to that point. So you can say it's very important to note that, or it's very essential that I need to point out something. So we are giving a better sentence for showing that this is very important. Okay, we are emphasizing it with our own phrases and sentences, and that is about the vocabulary and the spontaneity part. And I also have to add with that the phrases that we use often. It's okay, I understand that. It's better, you'll be comfortable to say I understand, I totally understand, I can appreciate. It's all fine, you can do that, use it, no problem. But it should not repeat every time to console a patient. Okay, so you want to make a patient relax, but don't use it often, the same phrase repeatedly often.
Two role play cards also at the same
Yeah,
way.
yes. So you have to deal with the two role play cards.
role
So often phrases look very uncomfortable even for the patient. So we might think, as an interlocutor, I used to think that I'm not that, worried. Then why my nurses always keep on saying that don't worry or don't worry. So I had that feeling. So it is better understand the scenario and give the phrases. For example, the first step, when a patient asks questions, that's a very genuine question from your side, and I'll explain you in detail about that. You can say that way. Okay, and if there is even the mother-child scenario, we definitely say, as a mother, I totally understand how much worried you are about these. We just say about the condition, but add exactly what the condition is. If the child is having a skin allergy, then you can say in this way that as a mother, I totally can appreciate that how worried you are about the allergy that she's undergoing. So we are actually taking the scenario sentence from the card, which makes you feel, which sounds very spontaneous, rather than just telling the sentence. So take something from the card also and add it. Okay, so that's one way of making use of and presenting yourself very spontaneous. And definitely you have to be spontaneous, because do you think or do you expect our interlocutor to act in the same way our trainer has done to you?
Never, they won't.
They won't. So they will totally in a different, different way that they might react to you. So you should be spontaneous enough.
And also never expect something like they will be definitely giving the answer like in this way. Never expect, like in case if they are not answering in your expected way, you will be like confused and all at that time. So
yeah,
it's better not to do that.
Yes, that's true. And I think we'll come to the conclusion part of the speaking. So how do you ask students to conclude?
If towards the end, they are supposed to ask, do you have any queries?
Yeah.
Do you have any more concerns?
Yes.
Or do I need to give any more clarifications?
Yes.
If the patient side is saying no, I don't have any further queries, we can say that yes, I am glad that I have clarified all your doubts.
Yes.
And if in case if you have any more concerns, you can ask me at any time. I'll be always happy to answer you, or I'll be always at your service and whatever. And we'll be saying thank you for patient listening or thank you for cooperation.
Okay.
That's what like the normal thing to do with a conversation.
Yes, but there are situations where your trainer or your interlocutor won't allow you to conclude. They keep on asking you questions that sometimes you might already have cleared the doubt, but again they might ask the same doubt to you. So that is okay. Actually, they are trying to help you to maintain the time limit. To manage the time. But then you might have to stop in between. In some situation, you can don't try to explain again and again, even when they ask you to stop. Instead, wind it up suddenly. So you should be able to do that at the very moment, and you can say thank you for the cooperation, and do not stop in the middle of the sentence. Complete that sentence and thank you for the cooperation. Done. Okay, never do in the middle of the sentence. Complete that sentence, whatever you were planning to say, and do not make it a complex sentence. When you identify that your time is up, make it very simple and say thank you for the cooperation. So that's a very safe sentence that you can use. Thank you for the cooperation. Why? You're actually thanking the interlocutor for the cooperation, and also we are thanking the character that
they played us.
Yes.
Patient.
The patient who is responding to us. You're thanking both with a one dialogue. All right. So I think that's the best way that you can conclude the role play. And speaking would be the most interesting. The task among the four.
We are taking a role.
Yes, we are taking our role. So this will be after all the three modules. So half of your attention and pressure will be left. You have left it. Left apart. So enjoy the speaking during the examination time. Now I would like to again emphasize on certain topics that you can even look into now. Just go through certain topics, like there'll be a chance of definitely mother-child or father-child scenario is obvious, and it's been there continuously for all the examinations. So definitely you need to expect in this examination as well. So are you comfortable with dealing a mother? And also make sure that don't ask, you should insist mother to inform child or convey this to child or do the procedures to child. Never confuse it with mother as a patient. Okay, so we know the scenario it is child, but we often confuse it with mother as a patient. Don't do that. Okay, so make sure you're comfortable with the mother-child scenario, and also the phrases that you can use during that time. Don't preoccupy with the card too much. Listen to the patient and respond accordingly. That's very important. And even in this mother-child scenario, I think a skin-related issue can come. Okay, skin-related. Maybe last time there was heat exhaustion was there. Then government ear problems. Yes. Then again we had acne questions were there. Then what else? Boiled skin was there.
Scalds, I think.
Scalds, yes. Hot water spilled. Yeah. So that was there. So these are something related with the skin or the senses, like ear problem, eye problem. Can expect definitely. And heart related immunization card definitely is there. So always remember, do many immunization cards, because there is a limit for all these cards. Whatever, the patient might be confused about the immunization. The patient might confuse with other immunization. Maybe the patient might have had
taken
another immunization
vaccine.
Yes, so he might have the confusion with that and this. And also with maybe the patient might be an infected person already, and is it safe to take this immunization? So these confusions and queries will be always there in an immunization card. So do certain immunization card today itself. And I think this time there will be something kidney related, maybe try-week dialysis or kidney inflammation or urinary tract infection. So such things can expect. And knee surgery is another possibility that you can expect this time. And reinsertion or insertion of cannula, or reinsertion of reinsertion, catheter reinsertion, removal. Such things can be there. So wound care instructions definitely is a probability. Wound care instructions, and pre-operative and post-operative scenarios are very common. And so that's it. And I'm sure insulin administration, so self-insulin administration, such things, such scenario can be expected. Alright, and make sure that warm-up questions, you're familiar with the 7 warm-up questions, and practice that well too, and practice in front of a trainer, because if there is any correction they have to do that, otherwise this is the first impression, so we cannot spoil that, so make it the best. I think that's all about the speaking, I guess. Am I right?
Yes.
Okay, so Joffin, I hope you know Joffin.
Yes.
As always, the best explanation for speaking. Thank you, Joffin Paul. All right, so that's it. Is there anything to add, Akila? Almost, yes. So I hope, as I wished in the beginning, I hope the Saturday would be a very exciting and wonderful day for you. So perform well in the examination, and all the very best. And definitely we will be back on Saturday, 9 o'clock. And there no speculation, only the reality. So we'll be discussing all the speaking cards and writing a letter and the reading and listening in general. So wait till Saturday, and we will meet you on Saturday. Thank you so much for patient listening, and unique and exclusive. Thank you so much, Endo. So we'll meet you on Saturday. So thank you, Akila.
Thank you.
All right. So bye.